Hello, this is Dr. Mark Johnson. Thank you for joining us on our website at Prolotherapy Nashville. What is available to you on this website? First, this is a very extensive collection of information about prolotherapy, about platelet-rich plasma, about stem cells, and perhaps more importantly, about the diagnostic issues surrounding pain of connective tissue origin. What you may not realize, and what your practitioners that have been looking at you even may not realize, is that medical science has actually refuted a number of the concepts that have been held commonly by practitioners based on their training since the 1950s about body aches and pains. Things like osteoarthritis, things like tendonitis, bursitis, those types of things. Medical science has actually shown that many of these problems thought to be due to inflammation actually are not. My personal belief, based on the behavior of these conditions in the face of prolotherapy treatment, is that these conditions all represent unhealed connective tissue damage. In other words, for most of these conditions, we can actually successfully treat things like arthritis, even severe bone-on-bone, even people that are told they need a joint replacement. We can often successfully treat these conditions with prolotherapy. Many people aren't aware of that. So this website discusses the diagnostic issues surrounding pains of connective tissue origin in a way that will help you understand whether or not this treatment may be suitable for whatever problem you have. Now also, you have to ask yourself, I'm a highly trained surgeon. I practiced for approximately 20 years. My wife was a very highly trained healthcare professional who practiced for about 25 years in one form or another. Now, why are we here? What happened was that in both of our situations, mine following an injury when I was 26 years old, loading a truckload of railroad ties to edge a flower bed, Holly's following a motor vehicle accident. Holly and I were both fully evaluated by orthopedic surgeons, very, very competent, caring, experienced, expert orthopedic surgeons using standard thinking and diagnostic techniques. In my case, I was told, based on a number of things seen on my MRI, that I was looking at a several level back fusion in the very near future and that I should maintain very limited activity in the meantime. In Holly's case, she had a significant motor vehicle accident, following which she was having huge pain and significant activity limitation. We went through a very detailed process, including a CT and MRI and a forelimb nerve conduction study, trying to find out why she still had so much ongoing pain, and all the tests are normal. So they were unable to offer any explanation for why Holly was having these pains. What happened next was that we were both evaluated by a very skilled prolotherapist using an entirely different diagnostic mindset. This led to our problems both being accurately diagnosed. Both of us were treated with prolotherapy, and both of us had complete resolution of these serious problems. Now, that was a life-changing event for both of us, because at that point, we wanted to learn how to do this and how to offer this treatment to people. What happened was next, we decided to change careers. I was a urologist, a very highly trained surgeon. I was one of the earliest trainees of the Da Vinci robotic operating system. I not only took out prostates with robots, I also was advancing that realm by taking out kidneys and adrenals with the robot. I did a lot of advanced cancer surgery and other operations at a teaching hospital. So I had an excellent, large practice. Holly was a dental hygienist for years. She had a large practice and was very highly regarded in her field. So when we talk about leaving our jobs, those are actually very stable and frankly, very well-paying careers that we retired from in order to do this. Now, as we did that, we got some very interesting looks from our colleagues because we were very highly regarded in our respected fields. We both had excellent jobs. Why would we trade that for doing something like this that, frankly, many people had never even heard of? The answer is results. What we found during our training process for this was how widely applicable this treatment can be. Now, from that point, once we began seeing patients, we began even expanding our understanding of what can be treated with prolotherapy beyond what we've been trained to do. The way that happened was that I began looking at how this treatment works, what it was doing, and in looking at the medical literature, there is no sufficient explanation for even why this treatment works based on what people currently think is wrong with people that have body pain. But the treatment does work. So that calls into question what people think is wrong. Is that actually correct? And what we found is that I actually sat down and looking at all the different phenomena that we see in association with the people that we can fix with this treatment. I literally came up with a new theory of what's wrong with people that have tender and symptomatic connective tissue structures. These structures are also damaged, they're loosened, elongated, they allow abnormal joint motion. What we find is that things that are commonly called arthritis, for instance, aren't an inflammatory condition, they are damage that's due to the loosening of the joint. Cartilage rubs off, it isn't eaten by an inflammation, for instance. So, looking at this very different picture of what's wrong with people, we've been able to extend this treatment into a variety of conditions very successfully. Now, this is why we've seen the next phenomenon that we observed, which is that we were intending to offer this treatment basically to people in our area. And initially, we weren't even planning to retire from our other jobs. But what we found was very rapidly, this practice grew enormously. And we began seeing people not only from the local area, we began seeing people from all over the country. We have seen people currently from, I believe, 47 states and several foreign countries. So we ended up not only offering this treatment to our local community, but literally to the entire nation. In the process, we have learned even more about the actual causes of the pains that people walk through the door with. What has been fascinating, what we term the diagnostic issue here, is that most of these people have been told that their symptoms are due to something other than what they're actually due to. Now, how do I know what their symptoms are actually due to? Because if I can fix the problem, I can tell you which structures I worked in, and I can tell you that strengthening connective tissue, courtesy of a patient's own healing system. In other words, I'm triggering connective tissue healing. When I do that, if I can cause repair that completely eliminates a problem, you have to explain that. And we actually have a very satisfactory explanation for how that works, why it works. And that allows us to, again, expand this treatment into many, many different structures, areas, and conditions very successfully. Now, before we leave this topic, I do want to make one more point. When we're talking about the diagnoses that Holly and I both received that were not correct in my case, or in fact the absence of a diagnosis rendered in Holly's case, let me hasten to add that the people that were evaluating us were excellent. They did the best job they could possibly do based on their understanding, their ideas about what might be wrong in the diagnostic tests that they ran. The issue is not the performance of particular physicians in this situation. The issue is the diagnostic mindset, the training, what people think is and is not wrong with people. So the diagnosis itself is at issue here. And this is what is so fascinating to me about prolotherapy. Prolotherapy teaches us some very important things about what is actually wrong with people. What is so exciting is we've been able to use that understanding to help many, many, many people that have been through these lengthy odysseys through the healthcare system. We treat a variety of things. We treat people that are told they need a knee replacement. We treat people that have a sprained ankle that hasn't stopped hurting. We treat people with other sports injuries, very simple, straightforward things, but we also treat people who have been on lengthy odysseys through the healthcare system. They've seen multiple physicians. They may have had an operation or two or three. They may be seeing a pain clinic physician. We have, in a huge percentage of these people, been able to either significantly improve their lives or, in many cases, actually completely stop symptoms that have been, at points, disabling. People that are in wheelchairs, people that can't work or occasionally can't walk, with this treatment. This excites me, and this is why I want to make this information available to you that we've learned. This website basically is a summation of the things that prolotherapy has taught us, so I hope it's helpful to you.